Did you know that almost 800,000 people per year suffer a medical consequence due to misdiagnosis? Certain conditions are more likely to be misdiagnosed than others. In neurosurgery, unfortunately, I see a lot of patients that get misdiagnosed for a variety of different conditions. So let's talk about one of them. A 27-year-old female comes to my office for a second opinion, and she was diagnosed by another provider with fibromyalgia and chronic fatigue syndrome. Her biggest complaints are weakness and headaches. The headaches are primarily in the back part of her head, and they get worse if she bears down, like going number 2, or if she sneezes. She feels just weak all over and has these episodes where she'll just collapse to the floor. And when she tries to explain this to doctors, she almost feels like no one wants to listen to her or believe her. She had an MRI of her brain, but was told that this was normal. But is it normal? This is the midline sagittal view of the brain. What we're essentially looking at is if we were to take someone's head, split it right down the middle, and then separate it and look at the inside, this is the brain. These little measurements that I put here is not normal. Let me explain. So this is the model of our brain. And what we have is the cerebral cortex, which is this part of our brain right here, and then the cerebellum, which is the back part of the brain, as well as the brainstem right here. So if we separate it apart and look at the inside right here, this is the view that we're checking out on that MRI. We have the cerebral cortex of the brain, the brainstem, and then the cerebellum is right here. And what I'm pointing out right here is that the cerebellum is hanging down beyond the base of the skull. See, all of this material within the brain has to fit within our skull. And in some people, the cerebellum can simply be too large for the skull to handle, and it'll start to try coming out the base of the skull. So why is that an issue? The issue is that this is the brainstem, and then this is the cerebellar tonsils that's pushing on the brainstem out of this area called the foramen magnum. Here's a model of our skull. And so when I'm talking about the bottom of the skull, it's this area right here called the foramen magnum, and this is where the spinal cord exits to go down and form the spine. This is called an Chiari malformation. Let's talk a little bit about why this is an issue and is causing all of our symptoms. See, our brain is naturally bathed in a fluid called CSF, or cerebrospinal fluid. It's produced within the ventricles of the brain, or the fluid-filled spaces of the brain, and goes around and circulates throughout the brain, brainstem, and then circulates down the whole spine and back up. It provides important nutrients to the brain, as well as helps get rid of waste. Right here, you see a vital pathway where the fluid will flow around the bottom of the brain and exit down into the spine. So if there's too much cerebellum, this whole flow of fluid can become obstructed and not flow correctly. So if the fluid in the brain can't exit, you can imagine the pressure inside of the skull rises, and hence her headaches. There are different forms of Chiari malformation, by far type 1 being the most common. Type 1 develops when the skull and the brain are developing, and the symptoms can arise in childhood or early adulthood. I think of it like a mismatch of the brain and the skull developing, and the skull can't contain the excess brain. Type 2 and 3 are also very important to recognize, but these are congenital deformities within the brain itself and are often picked up at birth. We often think of young people as healthy, and they shouldn't really have any major medical problems, so I often see this misdiagnosed because patients can be gaslit. They have a variety of these weird complaints, and if the physician doesn't know any better, they don't really know the diagnosis, and it can be missed. Unfortunately, I see it a lot. It's so important as physicians to really listen to your patients and believe their symptoms, because they're not making it up. Any symptom, no matter how old or how young, should be investigated to try to find the etiology or the reason why they're having these complaints. My biggest piece of advice for patients is that if you don't feel like your doctor is listening to you, be your own advocate and go to somebody else for another opinion. We want to find answers for your problems, and things are missed because sometimes we just don't know any better. Physicians are humans too, and things can unfortunately be missed. What did we miss on our patient? The patient had very common complaints in type 1 Chiari malformation, consisting of occipital headaches and these drop attacks or feelings of weakness. And since her physician didn't make the diagnosis, they assumed that all of her chronic pain was fibromyalgia and that her fatigue was chronic fatigue syndrome. These are the two most common diagnoses that are given to patients with Chiari malformation before they have the right diagnosis. I showed this measurement on her MRI to demonstrate that her tonsils, or that part of the cerebellum, extended beyond the foramen magnum by 7.2 millimeters. The diagnosis of a Chiari malformation type 1 is a distension of the tonsils of 5 millimeters or more. Well, how could our doctor miss that? It's so obvious. I'll tell you exactly how it happened. The MRI was read by the radiologist as normal, and her family medicine doctor read the MRI report because family medicine physicians aren't always trained to read an MRI of the brain and all these little nuances that come along with it. That's the radiologist's job. And as a radiologist, they're looking at hundreds and hundreds of sequences of the brain, so it can be missed because they may not have the right clinical context to know what they're trying to read. The MRI report says it's normal. She keeps having these complaints and the doctors are trying to make the diagnosis, but they look at the report that says normal and there's nothing structurally wrong with the brain. So they don't really know what to do other than make these other diagnoses that fit the puzzle. Diagnosis of fibromyalgia and chronic fatigue syndrome, you just treat the symptoms, but her symptoms really weren't getting any better because there was an actual structural problem there that needed to be fixed. You see what happens. It's a circle. She keeps going back to the doctors keep trying to treat her, she keeps going back to the doctors, and so on and so forth, and she starts to think that she's actually crazy. I wish that this was the first time I've seen this, but it's not. So now that we have the diagnosis, what do? I ordered a special MRI called an MRI with CineFlow to watch the flow of fluid around her brain. There are some patients with massive amounts of tonsillar herniation that's pretty obvious there's an obstruction of fluid, but in her case it was pretty subtle, so I wanted to make sure before we put her through surgery that it would help and was really the culprit of her symptoms. Her CineFlow study did show some decreased flow around the base of her brain, so we discussed the risks and benefits of surgery, and she decided to proceed. Here's a video explaining how we do that surgery. Make an incision overlying the back part of the patient's brain. We then remove a small portion of the skull called a suboccipital craniotomy, as well as a laminectomy of the C1 vertebral body. That gives us the access we need to get to that portion of the brain. Once that's done, we then open the dura, or the covering of the brain. We first remove the cerebellar tonsils that are hanging down and then do what's called a duroplasty. Basically, we sew a graft onto the back part to give it more room for fluid to flow. Now, in some cases, a duroplasty is not always needed if there can be restoration of the flow around the base of the brain with just removal of the skull. And in her case, that's what happened. We didn't even have to open the brain itself. We just removed the compressive part of the foramen magnum and the flow of fluid was restored. She recovered very well from the surgery and went home 2 days after surgery and began to notice immediate improvement in her symptoms. She didn't have to be scared to sneeze or to go to the bathroom. Those are two things that as people without this problem often take for granted. It's been 2 years since her surgery and she's done great and is completely symptom-free. September is Chiari Awareness Month, so I wanted to bring light and recognition to this commonly misdiagnosed condition. For any of you Chiari warriors out there, know that there are doctors out there that will listen to you and take good care of you. After all, this is the basis of the Hippocratic Oath. Another case of patient-focused and compassionate care. Stay tuned next week, and I'll go through another case.